Welcome to Pete's Doc Talk TV. I am Dr. Mona Amin, a board-certified pediatrician and mom, and we're going to be talking all about tongue ties and lip ties, something that has a lot of strong opinions on both sides. Clip it, don't clip it, what do you do? I'm going to talk all about the data, or lack thereof, but also just clinically what we see, because although the data is lacking, we can also go by what we see in clinical practice. Before we continue, make sure you hit that subscribe button below this video because that's how you stay up to date on all of the content here on Pete's Doc Talk TV, and here we go. So tongue ties and lip ties. Never have I seen one little membrane cause so much division amongst everyone who evaluates tongue ties. So whether you see a pediatrician, an ENT, an oral surgeon, a lactation consultant, a speech therapist, and a feeding therapist, you're going to get a lot of different opinions. So I'm going to attach some resources for all of you to make a decision for your baby, but I'm also going to explain some things that I see in clinical practice so you can make the best decision for your child. The diagnosis and treatment of tongue tie in the United States has increased tenfold between 1997 and 2012. The likely explanation is due to increased awareness and diagnosis, and not so much an evolutionary change that babies now are just having tongue ties more. It's probably the same incidence that we've seen in years past, but now we're recognizing them more. I commonly hear people say that you must clip your child's tongue tie. So a newborn baby comes in and they're like, you need to get it clipped, because if you don't clip it, that child will have issues with speech, with eating, with so many different things. This is simply not true. Yes, we need to understand that there is a population of people with tongue ties that may have issues with speech, may have issues with feeding, but it doesn't mean that we need to clip every baby with a tongue tie. When discussing tongue ties and lip ties and these various issues, is it correlation or is it causation? So correlation will mean that maybe the tongue tie is involved in a process that impacts breastfeeding, impacts speech, impacts feeding later in life. Or is it a causation, meaning that this is the only and definitive reason that that child is having difficulty in that particular area? So when we look at tongue ties, it's likely more of a correlation and not a causation. Why is this important? If it was a causation, that means that we need to clip every newborn's tongue tie. But this is simply not true. We see thousands of lip ties and thousands of tongue ties that go on to cause no issues for that child. So it really is a function over appearance situation. Now, if we started to see all children with tongue ties, all children with lip ties, or a large majority of these children going on to develop concerns, then of course the medical community, your pediatrician, and anyone who's your first line will say, hey, we need this to be evaluated. We need this to be surgically repaired. There was a study published by JAMA Otolaryngology Head and Neck Surgery, which I'm attaching to the show notes of this episode, which looked at 100 babies. What they were looking at was if tongue tie clipping or repair was absolutely necessary, or if there were alternative options available. The average age of the patient was 34 days old, and all patients were evaluated by speech therapists as well as feeding therapists to have a full multidisciplinary approach to what's going on with their tongue tie and if it was causing functional impairment. Prior to going into surgery, all families were offered breastfeeding education to maximize techniques to see if that would help or if the child really needed a tongue tie clipping. Following this evaluation, 60% of children who were referred for tongue tie clippings actually never even needed to be clipped, because with proper breastfeeding education, they were able to have good outcomes. So this study brings up an important point. When we are assessing tongue ties and lip ties, are we just saying that this is the sole issue, this is the causation, or are we trying other things before we really say, hey, this is something that is warranted? And I think that's the big debate. There's not a lot of research on tongue ties that show the long-term complications. So we have to look at clinical practice. We have to look at, well, are we starting to see a lot of children be affected by tongue ties that truly impacts their speech and quality of life in terms of feeding and also breastfeeding? One of the big questions we ask ourselves in the medical community about procedures and if we need to clip ties, for example, is if we don't intervene, meaning if we don't clip a child's tongue tie, or lip tie? Will it lead to poor outcomes across the board? When I mean across the board, I'm saying that if we started to see a large population of children with tongue and lip ties develop issues, then of course the medical community would have guidelines to say, hey, we need to clip this. But in reality, it is a function over appearance situation. This is key. Is that tongue tie or lip tie the sole reason for that child's issues, or are there other things that we can do? For example, in that study, breastfeeding education. For example, speech therapy. For example, feeding therapy. So we don't want to solely blame the tongue tie or lip tie, but we want to look at it as a big picture for that child's well-being. Even the AAPD, which is the American Academy of Pediatric Dentistry, claims that more research is needed to look at the causative association between tongue ties and lip ties and breastfeeding, speech impairment, as well as feeding difficulties later in life. So even they agree that we need more data. This data also needs to look at whether the timing of the clipping, if it's even needed, is it going to cause any of these issues? So more research and data is needed, which is why you're seeing so many different opinions. Before we go into what could possibly happen with a tongue tie or lip tie, I want to go over some pictures on what these would look like. So first we're going to talk about lip ties, and I'm talking about the maxillary frenulum, which is that upper lip tie. In severe cases, it's thought that maybe it can cause issues with breastfeeding or bottle feeding, more swallowed air if it's very tight. But remember, for these things, we also want to make sure that we are assessing other things in regards to that latch. Are they having the proper bottle, things like that. So in this image, you see 4 different classes. Class 1, minimally visible attachment. Class 2, attachment primarily into the gingival tissue. Class 3, inserts just in front of the anterior papillae. Class 4, attachment just into the hard palate or papilla area. So if you do notice a lip tie in your baby and it's affecting your ability to latch or affecting your baby's ability to bottle feed, bring it up to your child's pediatrician. Also, bring it up to a lactation consultant if you are breastfeeding. Why is that? I would want that lactation consultant to evaluate, do we need to change positioning for the latch? Is it something else that we need to do before saying that it is in fact this membrane that's causing an issue? Like the study that I mentioned, we want to make sure that we explore other possibilities, other interventions before we consider a surgical procedure. So now we're going to talk about tongue ties. These are actually way more commonly talked about than lip ties, and I'm going to show you some pictures of some tongue ties and the different classifications. Class 1 ties are attached on the very tip of the tongue. This would be considered an anterior tongue tie. The appearance of the tongue tip often resembles a heart shape when elevated, so if the child were to cry or scream, you're going to see that it looks like a heart shape like in this picture. Class 2 ties are a little further behind the tip of the tongue, about 2 to 4 millimeters, and attaches on or just behind the alveolar ridge. They also fall under the classification of an anterior tongue tie. Class 3 ties are closer to the base of the tongue and attached to the mid-tongue and the middle of the floor of the mouth. These ties are generally tighter and less elastic. Class 4 ties are also called posterior tongue ties and are largely felt and not seen. And how I kind of look at it is when the child cries, you can see that heart shape, but you really need to feel it in order to be able to diagnose it. So tongue ties or ankyloglossia affects about 4 to 10% of the population. And not all of them go on to have any issues. So in that newborn period when breastfeeding is being established, a tongue tie can, not always, potentially cause issues with latch, issue with milk transfer, so the proper ability for milk to be transferred to the baby, pain for the mom. If any of those things are happening and your child has a tongue tie, it's important to get that evaluated. Now, what about those cases where we see a tongue tie, but it's not causing a problem for mom? If it's not causing a problem for mom, then we don't necessarily need to do anything about that tongue tie. So now, what about after that newborn period? Just say you have a child with a tongue tie, they had no issues with breastfeeding, there was no pain, good milk transfer, good latch. Will they go on to have complications because of their tongue tie? Not necessarily. How do we know this? Because we see, as pediatricians, a lot of children with tongue ties that go on to have no issues. So when we talk about if it needs to be clipped, it does still remain, is it a functional issue that needs to be evaluated? In terms of speech, it's thought that maybe because of the inability to elevate the tongue, there can be some issues with articulation of certain sounds mentioned below, rolling of R sounds, for example. So it's important that if your child has a tongue tie and you are concerned about articulation concerns, that you get an evaluation from a speech pathologist who's trained in tongue ties. They are going to be able to evaluate what's going on. Is this really the tongue tie? Is it something else that we can work on before recommending a tongue tie release? If after seeing and working with a speech therapist, there is still a concern, then it's a good idea to consider a tongue tie release. Similar to the newborn period. If we see a tongue tie in the newborn period, our first step, let's get the lactation consultant involved to see what we can do to maximize that latch. If there's still an issue, we recommend tongue tie clipping. I have seen so many cases of older children with tongue ties whose parents are very adamant about wanting the release. They feel like that's the reason why their child's not speaking, or that's the reason why their child's not eating. And in the end, that is a benefit risk for the family to decide. What we have seen while that family is waiting for the referral or seeing the specialist is all of a sudden that child starts speaking, all of a sudden that child starts eating. So the question remains, are we intervening on something that doesn't really need to be clipped, or does that child just need more time or a different intervention? And that's an example I wanted to give because we see that. We see many children and many parents concerned that maybe this is the reason for their child's lack of speech or lack of feeding. But time is what that child needs, or maybe another intervention. So that is why we need more data, and that is why I really like to empower parents to decide with their pediatrician, maybe with another specialist, on what they think is best based on the interventions that that child is getting and if there is a functional impairment. In terms of dental and oral development, data is limited, but seeing a dentist is a great idea if you are concerned about lip ties or tongue ties. A lip tie can cause a gap in the front two teeth, but the appearance alone is not a reason for surgical release of that lip tie. Treatment may not close that gap, and function is way more important than appearance. Also, lip ties do not lead to more cavities, but hygiene is important to get around that area. Remember that whenever you're doing an elective procedure for your child, an elective procedure means something that isn't medically indicated, but maybe it's something that you want to do for your child. It's a good idea to speak to two people, get two different opinions. You can talk to your pediatrician, you can talk to a pediatric dentist, you can talk to an oral surgeon who's trained in tongue tie releases, or you can talk to an ENT. It's nice to get two opinions on what's going on, and two opinions from people who are going to be doing the procedure or who are going to be making the referral. Remember that that's the advice if it's not causing any impairment. If it is affecting breastfeeding, you want to talk to a lactation consultant and your pediatrician. If your child's older and you are concerned about speech, speak to a speech pathologist, get your child evaluated, and also speak to your child's pediatrician. This is what's important. We want to make sure that we do other things before we say, oh yes, it has to be the tongue tie and the tongue tie alone, because we know that so many babies and so many children have no issues with the tongue tie. We want to see if there are other interventions before we release that tongue tie or lip tie. So in regards to the procedure, there are two major ways that it can be done, via a scissor or laser. Some pediatricians are able to do the scissor release in their offices. If they're not, they will recommend a referral to a specialist to decide whether a scissor or laser is recommended. In terms of which one to use, both will provide the release that's needed, but the laser will provide more precision. So if you have a posterior tongue tie, it's probably going to be better to do a laser. If it's more of a type 1 tongue tie, a very anterior tongue tie, a scissor may be beneficial. But you want to speak to your child's pediatrician to determine, is this needed? What is the next step? Who is going to do it? And if a scissor or laser is the best option. There's currently no data to show which one, scissors or laser, is better than the other. So that's why it's important to have a conversation with your child's pediatrician and or your child's pediatric dentist to determine if a tongue tie or lip tie release is needed and if a scissor or laser is the recommended procedure. After the procedure, you may be recommended something called myofascial release therapy, which is a form of therapy that helps restore the function of the jaw, mouth, and the tongue. So the question becomes, well, then why don't we clip all tongue ties or lip ties? If they really serve no purpose, why don't we just clip everyone? Because we don't want to deal with if it causes issues, if it doesn't cause issues. Well, it's a surgical procedure. It's not without risk, right? There's bleeding risk. With bleeding comes infection risk. And these are things that we want to monitor, and these are things that are important when we're doing procedures for our children. So with any procedure we do for a child, tongue tie releases included, we are looking at benefit versus risk. And if it's functionally impairing a child to feed at the breast, if it's causing functional impairment in speech, if it's causing functional impairment where no other intervention was helping, then of course the benefit outweighs the risk in that situation. The other issue that I see is an obsession with revisions and revisions of that tongue tie or lip tie. The problem with this is that when you keep surgically releasing these areas, it can lead to more scarring, and more scarring can reduce the mobility of that area. So I see this commonly, that people are saying you need to get it revised and do it again and do it again. But the reality is here, when it comes to that point, we really need to ask ourselves, is there something else that we need to be doing in this situation, another intervention? Because we don't want to keep surgically releasing something and it causes more scarring. After tongue tie releases, there are mobility exercises that are recommended, especially for that older child, but sometimes it can still lead to scarring. The other concern I have with tongue tie releases and lip tie releases is that some places charge $1,000 plus for this. This shouldn't cost you that much money. I get a little concerned when a place is charging that much out of pocket for a procedure, because we have to ask ourselves, is this procedure even necessary? Is this procedure something that's warranted? And why are we being charged $1,000+ for this? I would want you to go through your child's pediatrician. Your pediatrician may be able to do a clipping in their office, but if they don't, they can refer you to an ENT, they can refer you to an oral surgeon, they can refer you to the right people to get that evaluated, maybe through your insurance. I do worry that the people that are charging $1,000+ out of pocket are preying on the vulnerability of parents. And as pediatricians, we have seen the aftermath of that. We have seen parents pay thousands of dollars. We have seen infection. We have seen bleeding risk after these procedures. So I need you to go with a reputable place that you know has a good track record, that is not costing you an arm and a leg, and possibly going through your insurance if possible. The last comment has to do with that figure I mentioned earlier, that in the United States, we've seen a 10-fold increase of tongue ties since 1997 to 2012. It doesn't mean that more children are having them, it's just that more parents are noticing them and want them to be evaluated. But the question is, do they really need to be surgically released? You think about it from other countries. Children around the world have tongue ties, but they learn to adapt to their physicalities. They learn to adapt in terms of feeding, in terms of eating. So are we not giving children enough time? Are we not trying to do other interventions before we jump straight to a surgical procedure? I think that's why we're seeing a lot more incidents, and I think that's why there's debate on both sides. I think it is important that a family makes the best decision for their baby, and also the best decision for their child if it's an older child with a tongue tie. So if you are noticing concerns and you want an evaluation and potentially a release, you should find a team of medical professionals that are on board with that. If you want to monitor, you should be allowed to do that. This is your choice when it comes to a surgical procedure for your child. Thank you for tuning in. If you like this video, make sure you hit the thumbs up sign, comment below, and subscribe to Pete's Doc Talk TV, because that's how you stay up to date on all of my content. And follow me at Pete's Doc Talk on Instagram for more content for your child's health and wellness. And I'll see you next time.